All right, let's dive right in. Today, we're talking about a really critical safety update that's changing the game for asthma treatment all over the world. I mean, this is a huge shift that really challenges what we've all come to believe about one of the most recognizable things in asthma care.
You know the one, the blue reliever inhaler. For millions of people, this little guy has been a constant companion, a trusted lifesaver for quickly opening up your airways when you feel an attack coming on. It's always been the go-to for immediate relief, and for decades it was pretty much the cornerstone of how we managed asthma.
But here's the twist. What if I told you that relying on that inhaler, and only that inhaler, is now considered unsafe? Yeah, you heard that right. The world's top experts are now saying that using just the blue inhaler could actually be putting you at risk.
And look, this isn't just some small suggestion. This is a direct quote from the Global Initiative for Asthma, GINA. They're basically the leading authority on asthma care on the planet, and they're seeing it loud and clear. For safety, they do not recommend treating asthma with just a SABA. That's the technical term for your blue reliever by itself. This is a massive change. So, you've got to be asking, why?
Okay, so to really get why this rule has changed, we first need to bust a really old myth about what asthma actually is. It's not just about what happens when you're wheezing.
Okay, check this out. It all comes down to the squeeze versus the fire. The old way of thinking was all about the squeeze, that tightening in your airways, the bronchoconstriction. And the blue inhaler? It's great at relaxing that squeeze for quick relief. But the new understanding is that asthma is actually a fire. It's a chronic disease caused by underlying inflammation in your airways. That fire is always there, kind of smoldering in the background, even when you feel perfectly fine. The squeeze is just a symptom of that fire flaring up.
And this isn't just a catchy analogy. This whole fire idea is backed by solid science. If you look at the official GINA definition of asthma, it says it right there, plain as day. It's usually characterized by chronic airway inflammation. That's the key. It's an ongoing inflammatory problem.
And that right there is the whole problem with relying only on your blue SABA inhaler. See, it's awesome at fighting the squeeze, but it does absolutely nothing to put out the underlying fire. So every time you use it, you're just putting a Band-Aid on a symptom while the root cause of the disease just keeps on burning.
And that over-reliance, it's a huge danger signal. GINA has crunched the numbers, and they're scary. If you find yourself going through 3 or more of those blue reliever canisters in a single year, your risk of a severe asthma attack, we're talking an emergency room visit, goes way up. It's not a sign that your asthma is under control. It's a massive red flag that the fire is out of control.
Okay, so if the old way is out, what's in? What's the new, safer strategy? Well, the GINA guidelines lay out 2 main paths, or tracks for treatment. But one of them is now strongly preferred for safety reasons. So you've got track 1 and track 2. And the biggest difference between them is what you use for relief. The preferred method, track 1, uses what's called a smart reliever. It's a single inhaler that has both a fast-acting rescue medicine and an anti-inflammatory, the stuff that fights the fire. Track 2, on the other hand, is the old-school approach. You use your blue inhaler for relief, but you have to remember to take a separate daily inhaler to handle that inflammation.
So why is track 1 so much better? Well, the evidence is overwhelming. First off, it dramatically reduces the risk of severe attacks compared to just using the blue inhaler for relief. Why? Because every single time you reach for that inhaler, you're treating both the squeeze and the fire at the same time. It also makes things way simpler, often just one inhaler to worry about. And maybe most importantly, getting that anti-inflammatory in early and consistently is proven to protect your lungs in the long run.
This whole new approach isn't just about swapping out inhalers. It's about a totally different mindset. Good asthma care today is proactive, not reactive. It's about being in a continuous partnership with your doctor.
And that proactive mindset is built around a really simple loop: assess, adjust, and review. First, you and your doctor assess how things are going, your symptoms, your risks. Then you adjust your treatment plan to fit your specific needs. And finally, you review how it's all working. It's this constant, collaborative cycle that's designed to keep you one step ahead of your asthma.
And probably the most critical tool in this whole cycle is a written asthma action plan. GINA is crystal clear about this. Every single person with asthma should have one. This is your personalized roadmap created with your doctor that tells you exactly what to do when your symptoms act up, how to change your meds, and when you need to call for help. It really puts you back in the driver's seat.
All right, let's wrap this up and bring it all home. The bottom line is there's been a fundamental safety-first shift in how we think about asthma. We're moving away from just getting quick relief and moving towards getting true long-term control.
So what are the absolute key things to remember? Number 1, just relying on your blue reliever inhaler is no longer the recommended or safest way to go. Number 2, always remember the analogy, asthma is a fire of inflammation, not just a squeeze in your airways. Number 3, the best modern treatments use a reliever that fights both the fire and the squeeze with every single puff. And number 4, great asthma management is a proactive cycle, a partnership between you and your doctor.
And all of this really boils down to one final, crucial question you should ask yourself. Is your current asthma plan just designed to give you quick relief from the squeeze, or is it designed to give you true, long-term control over the fire? Having that conversation with your doctor could honestly change everything. Thanks for joining me for this explainer.